I am the Chief Medical Officer of the Washington Township Medical Foundation, and I was really excited to be able to work in our vaccination clinic when we started the vaccination process back in January. And it's just been a wonderful experience to work in the clinic, to look patients in the eye as they get something that they know and we know is going to benefit them and their health and their family's health. And by the way, pretty much 100% of the active physicians on Washington Hospital's medical staff got vaccinated. So I think this has just been a huge benefit to our community, our patients, and our doctors, and our staff. So when I went to the clinic, the staff said, Dr. Brooks, one of the roles we want you to play is that we get people who come in who are hesitant about getting the vaccination. They don't want to get it. So can you talk to the spouse who's refusing to get it, or talk to the client who's now changed their mind after they get to the doorway? So multiple occasions, I had to walk over and say, "Hi, I'm Dr. Brooks. Why are you thinking about not getting the vaccine?" Sometimes they would say it was, "I'm afraid that that's going to put something in my body, that it's going to change me. I've heard that there could be a microchip in there, and I don't want to have some foreign object." And so I would sit and try to explain to them, there is no microchip and there is no metal. The substances are benign substances. The issue of the needle, there had been this myth that somehow when the needle goes in, the needle stays in your body. And so I actually demonstrated for many patients that when I inject it with it's called the vanishing tip needle. When you inject it, the needle retracts in the other direction. The needle pulls back and it never stays in your body. And I think patients actually love that. They said, "Wow, that's great. The metal isn't in my body." Some patients were saying, "Well, I know stories about how African Americans were treated back in the Tuskegee. It turns out there's an African American doctor. Her name is Dr. Kizzy Corbett, and she's been called out by Dr. Fauci as being one of the experts in developing the vaccine." So I think it helped to reassure some of the African American clients that came that this had been developed by an African American doctor. All of the governing bodies for physicians, the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine have all recommended that this be given to pregnant patients, because that was a big issue. Some patients said, I'm thinking about becoming pregnant. I am pregnant. What should I do? So at the time when we started, there was some uncertainty, but now we've got certainty as more and more tens of thousands of pregnant women have been given the vaccine, and they have a lower incidence of being admitted to the hospital with complications from COVID. And in fact, we think that pregnancy, it puts women at a somewhat weakened state because their immune system is a little suppressed to allow them to carry their baby and not have their immune system attack their baby when they're pregnant. So if they get COVID, there's an increased risk for severe complications. And also, we now know that there's an increased risk for preterm birth at less than 37 weeks of pregnancy in pregnant women who acquire COVID during their pregnancy. So, and now we're seeing case reports of women dying when they get COVID during their pregnancy, and actually the infant dying. And that's been unbelievable tragic news that you see time to time on the news, which is even more of an argument. It will save you from being severely ill, and it will save your baby from being born prematurely. Another area that was the issue of allergy. Patients were about to get the vaccine and they said, "I can't do it, I'm allergic to peanuts, I'm allergic to cats, I'm allergic to all kinds of food substances." The fact is, let's examine what's in the vaccine, because I think that would help patients feel better about it. We don't have peanut substances, oils, and things like that in the vaccine. The vaccine does have some fat, it has some sugar, but you don't have what they usually are allergens contained in your vaccination. So, okay, proof's in the pudding. No one gets hospitalized for an acute reaction to the vaccine. It just doesn't have the allergens and the things in it that could cause a severe allergic reaction. And we've not had to hospitalize anybody because they got vaccinated. I know people are concerned about how fast this vaccine came to market. And I understand that, I really do, because the coronavirus is a family of viruses, and one of the first ones was the sudden acute respiratory syndrome virus that is called the SARS virus. And we've had experience with this family of viruses. And so therefore, there have been people working on it for many, many years at developing a way to either blunt the virus or develop a vaccine. And of course, they just pivoted their research to look at the spike protein that's on COVID-19, because that's a different way that this particular SARS virus works. It's kind of in the right place at the right time when we needed it. So it wasn't like we just developed this in 90 days. It'd been in the works for years. And I do want to mention that wearing a mask is the second part of this. Get your vaccination, use your mask. It protects you, and your children should use their masks when they go to school, just to decrease the transmission, which the mask helps in that regard. It's the best thing for everybody. It saves more lives.